There's only two people in the world who need nitric oxide. There's people who are sick and want to get well, and there's the people who are well and don't want to get sick. If I wanted to make you sick, chronically ill, I would get your cholesterol below 200. So you can't make vitamin D, you can't make testosterone, you can't make estrogen. I would use mouthwash every day. I would put fluoride in your drinking water, and I would put fluoride in toothpaste. And then I'd encourage you to take an antacid, completely shut down your stomach acid production, where you can't absorb nutrients and you develop autoimmune disease. And those 3 or 4 things are a recipe for chronic disease.
Chronic infections from wisdom teeth removal that usually go pretty asymptomatic. Do you think that that plays a big role in this as well?
When you start to look back historically at acupuncture meridians, and every tooth is connected to an organ, and yet if that tooth is infected, it's like the circuit breakers. There's no voltage getting through that circuit breaker. So if you get low voltage, low pH, low oxygen, and what is that? That's the Warburg effect. That's where cancer proliferates.
Hello and welcome back to the Vibrant Wellness Podcast. I'm Dr. Emmy Brown here with Melissa Gentile to bring you more health news you can use. Today we welcome Dr. Nathan S. Bryan, a world-renowned nitric oxide biochemistry expert. Dr. Bryan's pioneering research has transformed our understanding of nitric oxide's critical role in human health, aging, and disease prevention. With a distinguished career spanning over 2 decades, Dr. Bryan has authored numerous scientific publications, and his groundbreaking discoveries have led to the innovative therapies that leverage the power of nitric oxide to enhance cardiovascular health, boost athletic performance, and support overall well-being. Join us today as Dr. Bryan delves into the science behind nitric oxide, sharing insights on how this vital molecule can optimize our health. Whether you're an athlete seeking peak performance or someone looking to improve your cardiovascular health, Dr. Bryan's expertise will provide invaluable guidance and inspiration. Welcome, Dr. Bryan. How are you doing today?
Fantastic. Thanks for having me. Great to see you.
Of course. Okay, so I'm curious, Nathan, what inspired you to do this work? How did you land on nitric oxide? It's very, very niche.
Yeah, as any career, it's been a journey and it's been a progression. I've always had an interest in science and medicine. I got a bachelor's degree in biochemistry from the University of Texas. And then it was when I was at LSU School of Medicine where I was enrolled in a PhD program in molecular and cellular physiology, where this whole new science of nitric oxide was presented. A Nobel Prize had just been awarded for its discovery. So the scientific and medical community recognized that it was an extremely important molecule, but it was a gas that was produced in the lining of the blood vessels. And once it's produced in the body, it's gone in less than a second. So we really didn't have a clear understanding of all the ways that the human body made nitric oxide. We didn't have a clear understanding of, how much it was produced, what did it become, where did it go, what did it do, what were all the signaling aspects of it. And then we didn't have a clear understanding of why people lost the ability to produce nitric oxide. And then certainly there were no safe and effective therapeutics around nitric oxide, certainly not any solid dose forms of nitric oxide in an outpatient setting. So at that time, really the only nitric oxide-based therapies were in an inpatient setting where you deliver the gas through a nasal cannula. And that's been treating premature babies with pulmonary hypertension, adults undergoing cardiopulmonary bypass surgery. So it was an exciting time. It was a exciting field and a lot of unanswered questions. And for me, it was just, interesting enough. And, it's almost ironic because when I finished my inorganic chemistry course at University of Texas and then my physical chemistry course, I swore to myself I would never want to deal with nitrogen-based chemistry again once I get past those courses. And now here we are 30 years later, and that's what I spent the past 25 years doing. So.
Look where you are now.
Yeah.
Gosh, and you've achieved so many milestones in your career. I'd love to know, before we get into the nitty-gritty and ins and outs of nitric oxide, can you speak to maybe a couple of the most pivotal moments or discoveries in your research, kind of, the most compelling or fascinating ones in your opinion?
Yeah, there's 2 that stand out. There's from the basic science and there's really no feeling like discovery because for a moment in time, you're the only person in the world who knows this, right? And so for me, it came in the research lab. I was working along with one technician. And we were putting components together because what we were trying to do was, how do we mimic nature? How do we mimic the cell's ability to produce nitric oxide at certain flux, at certain rates, that could then recapitulate its production and signaling. And so we started screening a lot of natural products, traditional Chinese medicines, even traditional herbs that had been used in naturopathic medicine with a clear, long history of safety, but also efficacy in certain conditions. But really, the mechanism of action had never been completely elucidated. And so once we figured that under certain conditions, and we could modify those conditions, that we could start releasing a certain amount of nitric oxide, and we could dial that level of nitric oxide in based on how we combine these components and modifying the conditions. So that was kind of our eureka moment at the time, because we could make nitric oxide, we could quantify it, we could detect it, and we could dial in any level of nitric oxide we wanted. So really, we had a nitric oxide delivery system. So that was the first important observation, the discovery. Go, now we have something here. So I went and I filed invention disclosures with the University of Texas, and we filed patents, and then, now I have several dozen issued patents on that technology. So that was kind of the fundamentals of the basic science. But for me, productizing that technology, those discoveries, where we made a solid dose form of a nitric oxide gas, we were treating a patient at Texas Children's Hospital who had a very rare genetic disorder. It's an orphan disease called arginosuccinic aciduria. It's a long word. We call it ASA. But these kids will develop severe resistant hypertension. They have heart disease. They have kidney disease. They have neurological dysfunction that seem to be independent of the recurrent hyperammonemia. And no medicine that they would give these kids would lower their blood pressure or mitigate any of their kind of collateral symptoms or symptoms that couldn't be explained by the underlying diagnosis. So we first saw this kid in February of 2010. He was in the pediatric intensive care unit, a 15-year-old with a blood pressure of 210 over 115. And they were giving him all types of antihypertensive medications, and he wouldn't respond to any type of medication. At that point, we kind of figured it was a nitric oxide-related phenomenon. So they started dosing him with isosorbide, which is what's called an organic nitrate. It's metabolized into nitric oxide. And 4 days later, his blood pressure normalized, and he was released from the hospital, and he did quite well. So they started treating him over the next year with isosorbide. And standard with that type of therapy, he developed tolerance. So these drugs, patients developed tolerance to them over time. So he no longer was responsive to the organic nitrate therapy. Now the physicians, and I was working with probably 7 or 8 different physicians, from his pediatric cardiologist, nephrologist, geneticist, primary care doc, and a host of other specialists at Texas Children's Hospital. And so we made this lozenge for him, the natural product chemistry that I'd put into an orally disintegrating tablet. And really, it was the only thing left to prevent this kid from dying from a heart attack or stroke or from, kidney failure. So we dosed him, and 4 hours after we dosed him, his blood pressure came down to 130 over 80. And we monitored him for, I think, 6 hours, and it was completely stable. So we sent him home with it. He was taking one lozenge every 4 to 5 hours. And we followed him out for 21 months. He was off all prescription blood pressure medicine. His kidney disease resolved within 5 days. His heart disease resolved within 5 months. And we completely overcame this guy's kind of clinical symptoms that resulted from his genetic disease. So that was the aha moment for me, kind of in the clinical translation of basic science, that what we had here was going to change the world of therapy. Because if we could treat a kid that was unresponsive to every known medication out there, that had gone through the FDA approval for many different indications, that he was non-responsive to, just our simple technology that releases nitric oxide gas completely ameliorated all of this guy's multisystemic disease. So that was the other aha moment. Now we've really, and even the physicians couldn't believe it. We've never seen anything like this.
And it was sustainable.
It was sustainable. We published that in the American Journal of Human Genetics in 2011. We're 13 years out. The kid graduated high school. He improved his cognition. He started beating his dad in chess. We kept him off of liver transplant because his liver healed. And it's a remarkable story. It made worldwide news back in 2011 when we published this paper. And we've been able to replicate that in not only these urea cycle patients, but in a host of different patients with resistant hypertension for whatever reason.
I have to ask, Nathan, what makes that therapy, or maybe it's the delivery, sustainable as opposed to the pharmaceutical agent which failed him eventually?
Well, it's a mechanism of delivery of the nitric oxide. So organic nitrates are, without getting too technical, you've got like nitroglycerin or isosorbide. You've got a glycerol backbone with 3 nitro groups on it. So that's a nitroester bond that has to be metabolized and cleaved by mitochondrial enzymes that then release that nitro group that's metabolized into nitric oxide that dilates the blood vessels. So over time, and the mechanism of action of the tachyphylaxis isn't clear, but certainly you develop a tolerance to these drugs because of that mitochondrial metabolism requirement. What we do is completely different. So we, through natural product chemistry, we naturally produce nitric oxide. It's not dependent upon the oral bacteria. It's not dependent upon mitochondrial function of the individual patients. We deliver the same amount of nitric oxide no matter the underlying condition. So if your body can make nitric oxide, we do it for you. And then, go back to 2007, where we published, again, another seminal paper that changed the whole thought process around nitric oxide, because we reported that nitric oxide is a hormone. So then when you start thinking about hormone replacement therapy, how do we do hormone replacement therapy? Well, if you're low in thyroid, what do? I mean, conventional medicine wants to give you inactive synthroid or T4 and hopes your body can convert it into active T3, which most people can't. But in terms of, if you look at testosterone or estrogen, in men that want testosterone replacement therapy, what do? You give them testosterone. Same thing in postmenopausal women. We give them estrogen. We don't give them precursors in hopes their body can make testosterone or estrogen, because they've lost the ability to make it. And that was the same kind of philosophy they were using in nitric oxide. Well, we'll just give you arginine, citrulline, these precursors, and cross our fingers, close our eyes, and hope your body can make nitric oxide.
Right.
But the truth is those patients can, and that's the basis for their deficiency. So again, we actually produce this hormone, give the actual molecule, it goes systemic where it has its endocrine effects, and it initiates and recapitulates all the signaling aspects of nitric oxide. And that's the difference. And again, but more importantly, we improve the body's ability to make nitric oxide on its own. So you don't become dependent or develop tolerance to this technology, because again, it's a completely different mechanism.
And Dr. Bryan, you also wrote a book called Functional Nitric Oxide Nutrition. So this sounds very different than the supplementation you're kind of talking about in this case. What made you want to write this book?
Well, once we understood how the human body makes nitric oxide, just like in any other biochemical reaction, the human body is much smarter than any doctor or any pill, right? So we just got to give the body what it needs, remove from the body what it doesn't need, and let the body do its job. And so we knew that you could prime and activate nitric oxide production by diet and lifestyle. So our first kind of strategy is, let's give the body what it needs so that the body can make nitric oxide on its own. And then in a perfect world, you don't need supplementation. You don't need drug therapy. Just let the body do its job and get out of the way. So we discovered years ago that the mechanism of action of like a plant-based diet, a Mediterranean diet, the Japanese diet, the dietary approaches to stop hypertension, all well-validated dietary patterns through decades of nutritional epidemiological research, were cardioprotective, cytoprotective, lowered blood pressure. We discovered that it's the nitrate found in the green leafy vegetables in those dietary patterns that can be metabolized into nitrite through the oral bacteria and then produce nitric oxide in the body. And then we eliminate certain things like sugar, inflammatory diets, inflammatory foods. And then so elimination diets, promotion of a balanced diet in moderation with certain food groups. Then the body could actually start making nitric oxide on its own. So I wanted to inform the masses, the globe, on how do you take control of your own health, because it's clear there's doctors, Western allopathic physicians are not making anyone better. And it's the model doesn't work. I think it's clear we got the sickest people on the face of the earth. So let's figure out another way, empower the patients with the information and arm them with the strategies they can employ that are actually cost savings, and then improve their own body's ability to make nitric oxide. And what the basic science revealed at that time, that if we could improve nitric oxide production and prevent this age-related decline, you can prevent age-related disease, from cardiovascular disease, Alzheimer's, diabetes, autoimmune disease. I mean, it's really the basis for every age-related chronic disease.
And you mentioned some of those dietary factors that you want to be eliminating, like sugars and inflammatory items in people's diets. How does that directly affect nitric oxide production?
Well, so we'll start with sugar. Sugar is a poison. It's a toxin. And sugar, I tell people all the time, everybody spilt a little sugar on their countertop or spilt a soda and then don't clean it up. The next day you come back and it's sticky, right? So sugar is kind of a glue. It sticks to everything. And in biochemistry, we look at the ability of proteins and enzymes to maintain some structure and function and go from one structure to another. The best example is hemoglobin. When it goes from the arteries to the vein, it has to go to some allosteric transition, offload oxygen, pick up carbon dioxide. And it's this being able to maintain its kind of nimbleness and change its structure. But if there's sugar stuck to it, and we measure this as hemoglobin A1C, by the way, then you've lost the ability, you've basically glued it together, and it can no longer change its structure. And that same thing occurs in nitric oxide synthase enzyme. If sugar starts sticking to this enzyme, it can't transfer these electrons to produce nitric oxide. So, and then the other thing, it induces a lot of oxidative stress. It changes the pH in the oral microbiome. It completely changes the microbiome, changes the gut microbiome. And so you create these chronic inflammatory conditions, a lot of oxidative stress, which further suppresses nitric oxide production. So sugar is a clear mechanism of action, and then nitric oxide is required for glucose uptake into cells. So if we start to see an elevation in blood sugar, that tells our pancreas to secrete more insulin. Insulin binds, it tells the cell to bring in glucose, but the glucose uptake is dependent upon the cell's ability to produce nitric oxide. So the cell can't make nitric oxide because sugar stuck to it. Then glucose isn't brought into the cell. Hyperglycemia tells the pancreas to secrete more insulin. Now you've got hyperinsulinemia, hyperglycemia, and that's the inflammatory cascade of metabolic disease.
What a mess.
Yeah, I was going to say that it kind of it's almost like that kind of feeds off of each other now.
Yeah, it's a feed-forward cycle. That's unless you interrupt it, you're never going to fix metabolic disease, and you're never going to restore insulin signaling and address this pandemic of metabolic disease. And then the other thing, the other big thing are seed oils. Because to have intracellular signaling, you need cholesterol, you need these fats, these good fats in the cell membrane that maintain that intracellular to extracellular signaling. And if you get cholesterol below 200, or if you eat a lot of seed oils, then you lose the fluidity of the membrane, and then you lose that intracellular signaling. And then there's no communication, there's no cellular communication. And so that's really the mechanism of action of a diet that's replete with sugar, replete with seed oils, and then you put everybody on cholesterol-lowering medication, get their cholesterol below 200, and people wonder why we have a pandemic of diabetes, Alzheimer's, cancer. These statin drugs are mitochondrial toxicants. They're causing cancer, diabetes, because you've lost the ability of the cell to communicate with its outside environment.
It's a snowball of downstream events. Yeah.
And I tell people jokingly, and it's not a joke, but if I wanted to make you sick, chronically ill, I would get your cholesterol below 200. So you can't make vitamin D, you can't make testosterone, you can't make estrogen. I would use mouthwash every day. I would put fluoride in your drinking water, and I would put fluoride in toothpaste. And then I'd encourage you to take an antacid, completely shut down your stomach acid production, where you can't absorb nutrients, and you develop autoimmune disease. And those 3 or 4 things are a recipe for chronic disease where you become dependent upon pharmaceuticals. So you become a very good customer with a really good lifetime value of big pharma.
It sounds like a good portion of the population.
That's right.
Fluorinated water, mouthwash. I mean, these are like everyday things that we're just so accustomed to.
Yeah.
Antacids, massive.
Yeah. So, Nathan, when I think nitric oxide, I think vasodilation. We've already touched on that. You spoke to hypertension. I think a lot of practitioners, that is the very basic 101 physiology we think of. What else do you want practitioners to think of when it comes to nitric oxide? And you touched on metabolism, but maybe in simple bullet form, what should come to mind with nitric oxide?
Well, it was first discovered as a vasodilator, and I think that's still its primary role, because without adequate blood supply and vasodilation and regulation of blood flow to certain organs, tissues, and cells upon demand, and they fail. But the other thing that it does that, was just discovered, in the last 20 years, what it is, nitric oxide is the signal in the body that tells our own stem cells to mobilize and differentiate. And stem cells are how we repair and replace aging or dysfunctional cells and senescent cells. So if we can't make nitric oxide, we don't repair and replace dysfunctional cells. The other thing it does is it's the molecule that tells the cell to make more mitochondria. And then if you make efficient nitric oxide, then you have more mitochondria per cell, and those mitochondria become much more efficient at converting oxygen into cellular energy, or ATP. So that's 2. And then number 3, nitric oxide activates the enzyme telomerase that prevents your telomeres from shortening. So and those are the kind of the hallmarks of longevity, being able to mobilize stem cells, being able to have adequate mitochondrial function, and then preventing telomere shortening. And all of those are controlled by nitric oxide. So if you lose the ability to make nitric oxide, no stem cell repair, you develop mitochondrial dysfunction, and you develop shorter telomeres, and you have a shorter lifespan.
It's like, why should we care? Well, you named it right there. I mean, it's all about longevity now. So you're speaking our language.
That did kind of spark a question too. So one of the things that I'm thinking of, I know you mentioned how sugar kind of interferes with that process of producing nitric oxide, but what about toxins? Does that also interfere with that whole process there?
For sure.
I'm just thinking of, what's causing us to have that kind of slow decline as we age?
Well, I think it's 2 things. It goes back to the concepts of Linus Pauling, where he famously said that chronic disease is caused by nutrient deficiency. And I think that's still part of the story. But I think the other part, especially over the past 100 years, the accumulation of toxins. The world we live in is very toxic. The food we eat is toxic. So I think now it's more complicated, but it's still a very simple concept. The food we eat since the 1940s to the 2010s, there's been a 78% decline in nutrients in the food grown in America. So certainly every American is deficient in something. 95% of Americans are deficient in iodine. 75% of Americans are deficient in magnesium, and that's just 2 very important micronutrients. But then the other thing are, heavy metals, mercury and dental fillings. Will scavenge nitric oxide, shut down nitric oxide production. And it's really any heavy metal, any redox active metal like mercury, lead, cadmium, barium. A lot of these contrast materials that are used in imaging, whether it's CT or MRI. And of course, we know they cause kidney disease, and you have to do kidney function before you give patients contrast. And then there's other things, the fat-soluble toxins like the glyphosates, the herbicides, the pesticides, the sprayed on the food. All of that, again, the fat-soluble toxins are fat-soluble, so they accumulate in the cell membrane, disrupt intracellular signaling, and loss of cellular communication, loss of nitric oxide production. So all of that leading to the onset and progression of chronic disease.
Definitely a lot that goes into it here. And I know you mentioned on your site that there's actually 2 different ways that the body produces nitric oxide. Can you kind of break down how that happens?
Yep. Yeah, so the first pathway to be discovered, which led to the Nobel Prize, was an enzyme called nitric oxide synthase. And we call this the NOS enzyme. So it produces nitric oxide gas. And this enzyme is found in neurons. It's found in our endothelial cells, the cells that line the blood vessels in the body. And then our immune system has an enzyme that can be upregulated or induced upon cytokine upregulation. So about 4 hours after we see an infection or some inflammatory insult where it's an injury or a bacterial or viral infection, then about 4 to 6 hours later, that enzyme is upregulated in our immune cells, and then it shuts down bacterial respiration, prevents virus from replicating, and is part of our innate immune system. And that enzyme converts L-arginine into nitric oxide, and it's a 5-electron multi-step oxidation reaction, energetically, kinetically unfavorable. So it's a very kind of intense biochemistry to make nitric oxide through that pathway. But we have a clear appreciation of the enzymology and the biochemistry of how we get nitric oxide from arginine, but it's never because you're arginine deficient. So giving L-arginine doesn't make sense to a patient that's nitric oxide deficient because they're not deficient in arginine, so giving more is not going to give you more nitric oxide. So we understand what leads to NOS uncoupling. We know how to restore that. And so we can overcome this loss of enzymatic function with age. And then the other pathway, was discovered about 20, 25 years ago, was through the microbiome. The bacteria that live in our mouth that convert inorganic nitrate from green leafy vegetables into nitrite. And then when we swallow our own saliva, we get nitric oxide produced in the lumen of the blood, in the lumen of the stomach. But this requires, a certain nitrate-rich diet. It requires the right oral bacteria, because humans do not have a nitrate reductase gene or an enzyme. So we're 100% dependent upon the oral bacteria. So if you use mouthwash, or if you use fluoride, or use any antiseptic that destroys the microbiome in the mouth, in the gut, wherever, then it shuts down nitric oxide production. And most toothpaste contain fluoride. Most municipal water supplies contain fluoride. 2 out of 3 people wake up every morning and use mouthwash, completely killing the microbiome, shutting down nitric oxide production. When we reported maybe 10 years ago, people use mouthwash, we see an increase in their blood pressure. You lose the protective benefits of exercise. You develop erectile dysfunction. It's counterproductive to what you're trying to achieve here.
It's crazy.
Yeah. And then
So
antacids, the other major problem are the antacids, because now we have clear clinical data that antacids, specifically the proton pump inhibitors, completely shut down systemic nitric oxide production. The enzyme in the lining of the blood vessels is completely destroyed. The oral microbiome, as well as the enterosalivary production of nitric oxide, is completely shut down. And the consequences of that are people have been on PPIs for 3 to 5 years, 40% higher incidence of heart attack, stroke, and Alzheimer's. One drug causing a 40% increase in heart attacks, strokes, and Alzheimer's.
And people take it like candy. They get stuck on it.
Yeah.
It's supposed to
Well,
be
now,
a
you
trial.
can get these drugs over the counter. You don't even have to have a prescription from your doctor to get
Right.
these. And there's the Prilosec, the Prevacid, the Nexium, the Zantac. These drugs should be taken off the market. The big pharmaceutical companies who manufacture these should be responsible. I don't know if you've ever looked at the package insert on proton pump inhibitors. And if patients and consumers took time to read that, they would realize it causes kidney disease. It causes kidney failure, causes osteoporosis, increased risk of bone breakage and breaking of hips, increased risk of Alzheimer's, heart attack, stroke. If I told you this thing was going to cause all that, nobody in their right mind would take these drugs. But you could argue the pharmaceutical companies are compliant because they put the package insert in there and inform them, but who the hell reads it?
Sure.
You got to do the responsible thing and take these drugs off the market.
And so you mentioned kind of 2 different mechanisms or pathways here. One was through that enzyme, and one was through the oral microbiome.
That's right.
So would you say just because of the way that we treat our oral microbiome and our exposure to all of these things like mouthwashes and toothpaste and et cetera, would you say that the first pathway through the enzyme that you mentioned, is that more favorable? Like, do we not produce as much? Is there kind of a ratio? Is it different with everybody? Like, what's the main source?
Well, I think what we've found, and we've done this through kind of stoichiometric measurements of how much nitric oxide can be produced under both pathways. And what we're finding is that there's redundancy. There's enormous redundancy in human physiology. And the redundancy in nitric oxide comes from both pathways working together. So when we're young and healthy, we have a good NOS enzyme. All things are working in place. And so that production pathway is working. And we know through population-based studies that the older we get, the less functional that enzyme becomes. So I think, and that's the reason that kids can get away with eating a really poor diet. And, kids don't like green leafy vegetables, but
And all the sugar.
and all the sugar, because eventually it'll catch up with them. But they got such good endothelial function, and the enzyme is still functional in the lining of the blood vessel that it compensates for a loss of nitric oxide due to oral dysbiosis or just not getting enough nitrate from their diet. But the problem is, by the time we're 30, 40, 50 years old, and that enzyme in the lining of the blood vessels 50 to 40% of what it was when we were younger, and now we eat a poor diet and we're getting hardly any nitric oxide, that's when you develop ED, that's when you develop high blood pressure, mild cognitive disorders, metabolic disease. But we can certainly overcome that loss of nitric oxide synthase production through feeding this dietary pathway. We've demonstrated it in animal models that can make nitric oxide in the lining of the blood vessels, so we can completely rescue their disease phenotype simply by giving them the nitrate and the nitrite through the diet. So we can completely rescue that. But ideally, you want to maintain normal endothelial function, maintain a good, healthy oral microbiome, eat a diet that's replete in nitrate, and give your body what it needs to make sufficient stomach acid. So now you're continuously making nitric oxide throughout the day in the lining of the blood vessels. For the 6, 8, 10 hours after you eat a meal, you're getting this constant production of nitric oxide through this, constant reduction of nitrate by the bacteria swallowing your saliva, burst of nitric oxide in the lumen of the stomach, and there's your endocrine function and hormone function of nitric oxide.
And how do we keep our lining of our blood vessels healthy?
Well, number one, you got to exercise. Exercise stimulates and activates nitric oxide production. Both testosterone and estrogen stimulate and activate nitric oxide production. Vitamin D stimulates and activates nitric oxide production. So we got to maintain normal, healthy hormone levels. Get your vitamin D around 80. They say 50 is normal, 80 is optimal. Restore the production of testosterone and estrogen. Get rid of these, endocrine disruptors, so your body can make normal levels of hormones, including thyroid hormone. And eat a balanced diet in moderation. And really, you have to eliminate sugar. And it's really that simple. And then, sunlight, 20 to 30 minutes of sunlight a day can stimulate and activate nitric oxide release in the body. So those three things to stimulate nitric oxide production. But number two, you got to stop doing the things that are inhibiting it. So get rid of fluoride, stop using mouthwash, wean off antacids, and then give the body what it needs, replete missing nutrients and through supplementation typically. And now you've given your body what it needs to make nitric oxide, and you've removed from the body what's inhibiting nitric oxide. Mm-hmm. And that's the basis. I'm not here to sell you products. I'm here for you to take control of your own health and do these simple things that are actually cost savings. But it's very difficult. Sugar is one of the most addictive substances on earth, and it's very difficult for people to eliminate sugar from their diet.
Mm. So what about fluoride, Nathan, in terms of how do you like to get it out? Do you advocate for any water filters? There's a lot of opinions out there. I'd love to know, kind of, as you said, fluoride is in most water supplies. So what kind of filtration do you like?
Well, you go back and why do they put fluoride in your drinking water? To kill the bacteria. Mm-hmm. It's not just, so it's an antiseptic.
But we're made of so much bacteria. We need that. Like we have more bacteria DNA than our own DNA.
No, that's exactly right.
We're all bacteria, yeah.
But what they don't also tell you is fluoride's a neurotoxin. Mm-hmm. If you go to the store and you buy rat poison, it's sodium fluoride. Ugh. And then if you look at the back of your toothpaste, if you use a fluorinated toothpaste, it says call poison control if you swallow this product. It's a poison in your toothpaste. Poison control center number is on the back of your fluoride toothpaste. So it's a neurotoxin. It shuts down your thyroid function because you remember fluoride is a halogen. If you go back to your periodic table, it's on that next to the last column in the periodic table. So you got iodine, bromide, fluoride, chloride, and then I think there's one more. But if you have too much fluoride, and I've already demonstrated through the NHANES study that everybody's deficient in iodine, less iodine, more fluoride, you develop thyroid disease. You can't convert T4 to T3, and we've got a pandemic of hypothyroidism. And again, the other problem is it's an antiseptic. So you have to get a home filtration system that specifically removes the fluoride, the chloramines, the chlorine that they put in it, and all these other, drug metabolites that aren't filtered through, municipal filtration systems. And then, yes, because it's not just the water you're drinking, it's the water you're cooking in, it's the water you're heating up to 105 degrees and bathing in and volatilizing all these toxins, and you absorb it through the skin. They're small molecules. So it's a toxic soup, and you have to get a home filtration system that removes all that.
And what about reverse osmosis, carbon? Can you speak to any of those technologies?
Yeah, there's a company I use called pH Prescriptions. They're out of Florida. There are a lot of good water filtration companies out there. I use them. I got a house home filtration system. I got a hydrogen water drinking system they've developed. And for me, it's just about removing the toxins from the water, but you actually got to remineralize it. You just can't take, complete 18.2 mega ohm reverse osmosis water and drink it, because then you'll leach all the minerals out of your body if you drink it. So you've got to remineralize the water. And part of what I like what they do is they remove all the toxins, but they remineralize it to basically provide a really healthy water that you're drinking, that you're cooking in, you're bathing in, you're washing your clothes in. So it's a combination of that.
Nice. Thank you for that.
What about drinking spring water?
Like natural
Or is it
spring water
kind
in a bottle.
Yeah. Like some glass bottled natural spring water.
Yeah, look, I think natural coming from, nature's source is best. Plastic, you're going to get leaching of a lot of these, endocrine disruptors. But water is a huge business. It's very expensive to ship water all around the
Very.
world, especially in a glass bottle. So it's a very tough economic model. But yeah, I think natural spring water that contains natural electrolytes, free of toxins, and is a good thing.
I'm curious, Nathan, what about oral prebiotic, probiotic therapies? As we're speaking about the oral microbiome, obviously, if we can eliminate sugar, that's going to do wonders for our oral microbiome. But do you like any therapies? And I'd love to know how you assess the oral microbiome. So two-part question there.
We started out talking about these test strips, and I developed these test strips back in 2010 because the first thing we recognized was that people didn't know if they needed nitric oxide. And today I tell people there's only two people in the world who need nitric oxide. There's people who are sick and want to get well, and there's the people who are well and don't want to get sick. So if you're one of those two people, you need nitric oxide. So we started testing the saliva because we understood this bacterial reduction of nitrate to nitrite that we then pick up through these test strips. So I developed that first kind of point of care salivary diagnostic test. I filed patents. And it's old chemistry. I abandoned the patents probably back in 2013. So now a lot of companies are selling these strips that I developed. But I think it's a good tool to have in your toolbox. But the problem is, in people that have active oral infections, they'll light up that test strip because of the local immune response. So, this came from a 50-year-old with high blood pressure, diabetes, erectile dysfunction, and he was a clinical mess. So we tested him for nitric oxide, and he lit up that test strip like a Christmas tree. He goes, I have plenty of nitric oxide. So he was completely devoid. He just had an active oral infection.
Oh,
That
God.
was turning that test strip pink. So we've gotten away from the test strip just because we're finding that so many people have, sometimes it's an asymptomatic dental infection that's causing that local immune response and leading to a false positive on those. But to answer your question, we identified these bacteria back in 2012, 2013. And I filed a number of patents on trying to use these as both diagnostics and treatments for it. But there's not a single oral prebiotic or probiotic that I've tested that's on the market that seems to be affecting these nitric oxide producing bacteria. We're developing now a mouth rinse and a toothpaste that we've been able to restore the function of the oral microbiome. So it's it's doing two things. It's preventing the loss of the microbiome because there's no fluoride, there's no antiseptics in there. But we tried to go a step further. In people who don't have the right oral microbiome, can we put a technology in there that can give these patients now the right oral microbiome to lead to adequate nitric oxide production? So be on the lookout for that. It's going to be a game changer in dental medicine. A couple of weeks ago, I was in Chicago at the American Dental Association presenting our early preliminary results on this, and I think it's going to be a game changer. We finally got the attention of the American Dental Association to, let's have a discussion about fluoride and the standard of care of fluorinating every patient that sits in a dental chair. Let's have a discussion about, chlorhexidine and antiseptic mouth rinses and, trying to get rid of the pathogenic bacteria. But how do you do that without destroying the non-pathogenic commensal bacteria? And I think we've been able to solve that riddle. I think it's going to change the world of dental medicine.
Very exciting.
That made me think of also just kind of and I don't know if you have any insights to this, but the whole concept of these kind of chronic infections from wisdom teeth removal that usually go pretty asymptomatic. Do you think that plays a big role in this as well?
Absolutely. These cavitations, whether it's a root canal tooth or it's a previous extraction where there remains some, low-level infection, in that in the tubules of the jawbone, that now these anaerobic bacteria are completely isolated. Because whether it's an extraction or whether it's a root canal tooth, there's no blood supply to it. The nerve root in root canal teeth have been removed, so you don't feel the pain. If it's an infection, it's completely isolated from your cardiovascular system and your immune system, because a root canal tooth, there's no blood supply to the tooth or the jawbone. So now these anaerobic bacteria are sitting there and they're multiplying, they're replicating, they're excreting toxins, and they're making people deathly ill. I think, and I've seen this to believe it, that ALS-like symptoms are most of the time due to an asymptomatic root canal tooth
Wow.
infection. Cancer, I've never seen a cancer patient who didn't have an active oral infection. Most of them are asymptomatic. Root canal teeth eventually cause cancer. This, I'd been to many dental conferences and I'd heard this, but it to me was completely foreign. Again, how can an infected tooth cause cancer? But when you start to look back historically at acupuncture meridians, and every tooth is connected to an organ, and yet if that tooth is infected, it's like the circuit breakers. There's no voltage getting through that circuit breaker, so you get low voltage, low pH, low oxygen. And what is that? That's the Warburg effect. That's where cancer proliferates. And so in 2015, I met a cancer patient. She was been treated at MD Anderson for 6 years. She had stage 4 metastatic colon cancer. I saw her radiology reports. She had cancer in every part of her body, her long bones, her ribs, her brain, complete colon resection, or removed her colon, chemo, radiation. They sent her home on hospice and gave her 6 weeks to live. And I was giving a lecture at some event, and I just mentioned at a passing root canal teeth and the connection to cancer. And she came up to me, she goes, "Nathan," she goes, "I'm dying of cancer." And I said, she goes, what is this root canal? And so I just told her a little bit about what I knew. And I said, "Do you have any root canals?" She goes, "Like 13. And I go, "Well, you need to go to the dentist and let them do kind of a 3D CT cone beam scan of your jawbone. And let's see if there's an infection in there that may be contributing to your cancer." She went to the dentist. I didn't hear from her. I referred her to a dentist, and I didn't hear from her for about 6 months, and thought she probably died because she looked like she was about to die. And 6 months later, I got a phone call from her, and she goes, "Nathan," she goes, "I took your advice on a whim. I had nothing to lose. I got all my root canal teeth extracted. They were all infected. They cleaned up the infection. I'm just coming back from MD Anderson, and there's no cancer in my body."
Oh my gosh, I have chills.
Wow.
Yeah, I mean, to me, and that was 9 years ago, and she's still living today, free of cancer. And her doctors at MD Anderson can't explain it. They go, "Well, probably the chemo just started working."
Of course.
They had no interest in what cured her. She told her about all this, the root canal teeth and remediating the dental infections, and they go, "Well, we've never heard of that." Obviously, that wasn't contributing to it.
Yeah.
So that's the resistance we're seeing in this. So and I've replicated that dozens of times. And so when I see a cancer patient, I always tell them, "Do you have a root canal?" "Yes." "Okay, we'll go get it." And then some people look at me like I'm crazy, and all of those people are dead. The ones that take a leap of faith and just doesn't make sense to them, but they go do it, they survive. I mean, it's really that simple. It's crazy.
I think it's being talked about a little bit more now. I think some other doctors are kind of bringing that a little bit to light. So if anyone here listening is thinking, "Oh, I've had wisdom tooth extractions, I've had root canals," and they want to go get a scan done of their jawbone to look for infection, can you go to any dentist, or does it have to be like a biological dentist? Like, what do you recommend for people to search for?
Yeah, there's two really good organizations. There's the IOAMT, which is the International Association of Oral Toxicology and Medicine. And then there's the organization called IABDM, International Academy of Biological Dentistry, Medicine, or something like that. But these are what you call biological dentists. So most general dentists and orthodontists, and certainly endodontists, they have to have a special imaging device called a 3D cone beam. It's a scan. It's a 3D panoramic of your entire jaw. So dentists who still use x-rays, an x-ray will not show the radiolucency of an asymptomatic infection and the osteonecrosis that you see from a chronic infection. So you have to use this high-resolution CT scan that limited number of dentists use. So if you want to call the dentist office and ask them if they've got a 3D cone beam, then they can image it. Then the next step is, how do you read that? How do you interpret that? And then if there's an issue, how do you appropriately mitigate and remediate the infection? And that's where these biological dentists come in, because the only way to do it is through ozone gas. Because you got to remember, if they're treating you with an oral antibiotic, it's not going to work because there's no blood supply to that area. They can do it with an aspiration of a liquid like water, but the surface tension of water is too high to get into those very small tubules where the bacteria are actually living and replicating. So you have to use ozone gas. In any dental office that uses ozone gas typically will remediate properly an infected root canal or previously extracted tooth where there's a cavitation, because the gas will fully penetrate into the tubules and kill the bacteria and the infection. And then depending upon the degree of osteonecrosis, a lot of times you'll have to do a bone graft or platelet-rich fibrin in there to heal the jawbone, to regrow it for an implant. And if not, then the implant will fail, and then you've got a whole series of other problems. But yeah, finding the right dentist is the absolute most important thing, and probably the most important people in healthcare.
I'm glad we went over that. That's super helpful for our listeners. Thank you. Can we talk about beets now? I want to lighten the
Beets?
mood. Talk
Yeah,
to me about
beets.
beets.
Oh, geez. Yeah, beets became a hero vegetable back in 2012. And there were starting to become a few clinical studies showing that if you drink beet juice, you could enhance your exercise performance. And in some studies, it showed that it would lower blood pressure. So in London, and a lot of these studies came out of universities and medical schools in London, in the UK. And in 2012, London hosted the Summer Olympics. So during that time, it was realized that a lot of these Olympic teams were drinking liters of beetroot juice before their event to try to improve their performance. The problem was it caused enormous gastric discomfort. It changed their urine to a bright red. People thought they had, bladder cancer or something, and it turned their feces red, and people thought they had colon cancer and, gastric bleeds. So we started down that path about 2012, because what I tested was all the beet products that were on the market, the beetroot powders, beetroot juices, didn't contain any nitric oxide whatsoever. And so this is by virtue of if they contain inorganic nitrate or nitrite that the body can convert into nitric oxide. So I go, a lot of these athletes are being duped into taking something that's providing no advantage and no benefit to them, because these companies don't understand the mechanism of action of how this is supposed to work. So we started developing fermented beet powders that actually deliver nitric oxide gas. And now today, there's hundreds of these products out there, and unfortunately, 99% of them provide no nitric oxide benefit. The other problem was, including me, I hate the taste of beets. I couldn't take them. I don't like beets, and I couldn't really eat them or drink them without, initiating a gag reflex. So we had to make it to where it was palatable, and people could drink it and still get a nitric oxide benefit. And we developed most recently a product called NO Beets, where we have a fermented beet product. We take the oxalates out. We take the beet pulp, the beet kind of fiber out. So it's a white powder. Doesn't look or taste like beets. It's kind of a mixed berry flavor. And when you put it in water, it produces nitric oxide gas. You consume it. Now you've got a nitric oxide generating technology that improves performance, can regulate blood pressure, and really an incredible pre-workout or athletic performance product.
And that would really be beneficial for someone who may have low levels of that NAS or NAS enzyme, because it's already processed.
That's right. Yeah. So as soon as you put that in water and take it as a shot, if your body can't make nitric oxide, we're doing it for you. Then,
got it.
Then you have to be careful, because there's so many companies out there spending millions of dollars on advertising, trying to sell you beets in a gummy or a chew and all these canisters. And number one, it doesn't produce nitric oxide. Number two, these gummies and chews are full of sugar, which completely destroy the microbiome. Last thing we need is more sugar. The other thing, you look on the label, they're riddled with seed oils. This waxy substance is the seed oil. So seed oil and sugar, you have to avoid. So And gummies and chews have become popularized, and companies putting, vitamins in gummies and chews for kids, and beets in gummies and chews. And you can't deliver nitric oxide in a gummy or a chew. And two, if you want to destroy your oral microbiome, take a gummy or chew. You want to shut down nitric oxide production, take a gummy or chew. So there's no reason anybody out there should be buying gummies and chews, because it completely destroys nitric oxide. It does not promote it.
It sounds like that's really not a great, way to supplement. But I feel like that's kind of where our industry is going, is making supplementation taste good. People don't want to taste the earth, or taste what they're changing so much. And sugar has just become, exactly.
There's
100%.
fads, there's fads of delivery. There were the gel packs people were using, then gummies become popularized. And so people want to put nutrients in these cool and innovative delivery systems, but without any kind of science directing them, they're basically, duping and defrauding the consumer into buying something that doesn't provide any real benefit just based on the latest fads. We have to hold these companies accountable, because, for me in the nitric oxide field, I bring this to light because these companies could kill an entire field of nitric oxide. Because I hear this all the time when people go, Nathan, we talk about nitric oxide, but I don't think it works for me, because I've been taking these beet powder that says nitric oxide, or these gummies that I see advertised on TV, and it didn't change my blood pressure. I didn't feel better. In fact, I may have felt worse. So nitric oxide doesn't work for me. And I go, wait, that product didn't work for you. So please don't misinterpret that it's the nitric oxide that didn't work. That company failed you. Nitric oxide didn't fail you. If you take a product that produces nitric oxide, your body never loses its ability to respond to nitric oxide. It loses its ability to produce it. So if we can provide it for you and improve your body's ability to make it on your own, then your body's going to improve. Your blood pressure is going to normalize. Your athletic performance is going to improve. We see an improvement in sexual function. We see an improvement in cognition, because we're regulating blood flow and oxygen delivery, improving mitochondrial function, mobilizing stem cells, and preventing telomere shortening. All that through the production of nitric oxide.
Dr. Bryan, I do want to squeeze in one last question before we wrap here. So I know you mentioned earlier just the nutritional value in our food overall is really declining, especially as our topsoil starts to diminish. Are these nitrates coming from our topsoil? And does that mean that our foods that we're buying in the grocery store, even though we're spending the extra money to get organic or to buy local if we can, is that level of nitrate going to be lower in like beets and greens as compared to maybe like 30, 40, 50 years ago? And is that contributing to the problem?
Absolutely. So if you look at and this is a database that I didn't create, but it's a published database. So the food grown in the soil in America, and I don't remember the geographic location, but they took food and nutrient density analysis of foods grown in the 1940s, and they did that same analysis of food in the same geographic area in, I believe it was 2010. And there was a 78% on average decline in the basic micronutrients and macronutrients in the soil. They didn't report on nitrate. They were things like selenium and chromium and vitamin A and other nutrients that are found in vegetables. But what we published on in 2015 is we went to 5 cities across the U.S., New York, Raleigh, Dallas, Chicago, and Los Angeles, from the same retail grocer, and we bought, 5 or 6 different vegetables, and we analyzed the nitrate content. And there's as much as a 80% difference, or 8-fold difference in the amount of nitrate in celery found in New York versus celery found in Dallas. So there's geographical differences. Then the other important finding from that study was we compared conventionally grown vegetables to organically grown vegetables. And the organically grown vegetables had on average 5 to 10 times less of the nitrate than conventionally grown. So to answer your question, it's all about nitrogen in the soil, because to get an organic label in the U.S., no herbicides, no pesticides, no fertilizer. But yet without standardizing the nitrogen in the soil, you can't assimilate nitrogen in the form of nitrate in the vegetables that are grown in that soil. Now, you can add manure and compost matter, but again, there's no standardization of the nitrogen in that type of fertilization or farming practices. So what I do is, I grow my own vegetables, I raise my own beef, And so we don't really go to the grocery store to buy food. But I do soil samples every year, and I see what the soil's missing. And then I use standardized fertilizer, usually 28% nitrogen, 14%, potash or phosphorus, and then add sulfur where it's needed. So my vegetables that I eat aren't considered organic because I'm adding fertilizer, but I certainly don't use any herbicides or pesticides. The downside of that is I got to compete with the grasshoppers and the worms and get to my garden before they do.
Right. So we really have to change our farming practices if we want to attack that whole issue kind of as a whole here.
That's exactly.
Wow. Well, there's definitely, a lot to unpack here. I really never understood before this interview here or this episode how important the production of nitric oxide is and how it even happens, and how we have to convert, nitrates with enzymes and how those enzymes deplete as we age, and how this is really a really big key to longevity and preventing disease. And there's so many other rabbit holes we've kind of gone down with different disease preventions. I know you get a lot on your blog. So anyone tuning in today, if they want to read more about this, find you online, where can we find you?
I send people to my YouTube page because I think it's a new platform for, getting education and content. We do a lot of podcasts. We'll post this on there, and lectures and kind of some timely information. That's Dr. Nathan S. Bryan, Nitric Oxide. We've got another podcast we developed called Heartbeat Happy Hour. It's on YouTube.
Oh, I love that name.
So yeah, we sit
name.
down typically in the evenings with a scotch and, just talk about the times of the day. Most of it's nitric oxide, but, a lot of times it's completely independent of nitric oxide because, there are other important things that you have to consider in health. Nitric oxide is not a silver bullet. It's not a panacea, but it's foundational and you have to restore its production. But there are other causes of chronic disease that you have to address. And then, I send people to I got an educational website, drnathansbryan.com. If you want to read my scientific papers, you can go to PubMed and search my name. What else? I'm on Instagram, Dr. Nathan S. Bryan, although that account was hacked.
Oh, no.
So now I got another account called The Real Dr. Nathan S. Bryan. I guess we'll have to build out to 100,000 or more like I had on the other one. And then those interested in product technology, which is, I'm not here to sell you products, but people want to look for solutions. It's n101.com. That's the letter N, the number 1, the letter O, number 1.com.
I love it. Well, we make sure to link all this down in the show notes as well. So anyone tuning in can find your website, learn more from you, dig into the research. And again, thank you so much, Nathan, for your time today and providing us with so much of your expertise. I know our audience is going to get a lot out of this. And for everyone listening, until next week, wishing us all vibrant health and wellness.
Thank you, ladies.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.